Hi, everybody. I have a new toy. I got it for my birthday. It says on air right behind me. So we are officially on air. And I'm with Dr. Tara Chalakani, the CEO of Preferred Behavioral Health Group, which is an extensive, I don't know if you can see that, it's an extensive series of mental health, et cetera, clinics throughout Central Jersey, primarily in Monmouth and Ocean County. A big place, 500 employees. I mean, this is big time stuff. Um, I interviewed Dr. Tara a couple times. I was a guest on her Well Off podcast with Gina Simone, and that was a great thing. Uh, this is, I don't know, our second or third time together, and we just kind of connected a week or two ago, and the light bulb went off because Dr. Tara is nationally recognized in all the work she does. She's a CEO. Uh, um, you know, the stuff she does with mental health and substance abuse and youth and wellness and all this stuff was all under, her umbrella and her guidance as what she's doing. She's got 30 years experience. See, I did my studying, and all this stuff about you. And so when we connected a couple of weeks ago, all of a sudden the light bulb goes off. AI, mental health, and I've been dabbling in AI things for a couple of years, and I asked Dr. Tara if she'd like to talk about mental health and AI because there's tremendous amounts of considerations, and she immediately said yes. So here we are. So, my monologue is officially ended. If you want to say just a couple of words, please do. And then we are going to jump into mental health and AI. Take it away, Tara.
All right. Well, I would love to. And I'm impressed as always, Calvin. You do your homework and you know your stuff. You know what you're talking about. And I love connecting with you. And I feel like you always have your finger on the pulse of what's new and what's on the horizon. And AI is everywhere. And it certainly is everywhere in mental health as well. So I think it's an important time to have the conversation. So thanks for having me.
Oh, great. Perfect, perfect, perfect. So we talked before about the rising mental health needs in primarily Monmouth and Ocean counties. And we talked, a while back. Has the landscape changed a little bit since the last time we spoke? And are you seeing any particular pressures in mental health clinics, et cetera, et cetera?
I think, Calvin, the answer is a yes and no. I think that the demands are higher overall, but yet they're the same as people in my industry have always known them. But I think that we're opening up more dialogue, there's more awareness, there's more of an acceptance to embracing mental health care, which by nature will increase the demand. But I will tell you that one of the trends that has been prevalent for quite a while now, which was really exacerbated in 2020 by the pandemic, was the trend in younger and younger children with increased acuity in their symptoms for things such as being suicidal or depressed or anxious. That is something that has remained consistent and has escalated. Things that I see in our organization alone. And just for the clarification of your listeners, Preferred Behavioral Health Group serves all of New Jersey.
Okay.
So our major footprint is at the shore in Ocean and Monmouth, but we serve 15 counties physically, the whole state. And we're seeing tens of thousands of people one-on-one for direct care every year, close to 30,000.
Wow.
And when we think about education and prevention work in large groups, that's about 100,000. So we really have a lot of impact in the community and we see a lot and we hear a lot. And one of those things that I am seeing more and more of is exposure of a sexual nature that children are having, whether they're sending nudes, receiving nudes on their cell phones or through messaging apps. And I also think, and research backs me up, is that a lot of the reason why we're seeing earlier and more acute mental health needs with children is because they are exposed to so much. We're no longer putting dolls and trucks and games in the hands of children. We're handing them very sophisticated and expensive devices, and they have the world at their fingertips, including AI. So I think it's a nice segue to get into your questions today.
Okay. We're not all of this, we're not in any kind of a like global pandemic with mental health, are we? Or,
Well, I mean, if you think of it this way, the statistics have remained pretty consistent that 1 out of every 4 adults has a diagnosable mental health disorder. 1 out of every 4 to 5 children, it's the same. That varies from the source that you get that data from. But globally, if you take two people, Calvin, one of them in their lifetime will have some direct experience with mental health, whether it's themselves or it's a loved one. They're going to have a front row seat to lived experience of mental health. So that's half the planet. So I guess by statistical measures, we could call that a pandemic. But we still live in a world that minimizes mental health, doesn't put it on the same level of importance. I see it day in and day out globally as my role as a CEO, and then on a more micro level as a practitioner in my own practice, that people deny themselves the right to mental health care. They don't prioritize it the way they would a broken bone or a sinus infection, anything that you would be compelled to seek out medical care for. It's just not treated the same. We have this persistent belief that we can overcome it, we can get through it, we can shake it off, but it's an illness. It's dis-ease. We're at dis-ease in our body and our minds, and mental health impacts physical health. So I think that until we have some sort of agreement and congruence and agree that mental and physical health are the same and one doesn't outweigh the other and we treat them equally, we're always going to have this disparity.
mhm. Okay. So now, kind of moving into why we're here. So many people are turning to AI and chatbots and online therapists and all this kind of stuff because they're anxious and there's a lot of things to be anxious about. Every day there's another headline somewhere about being anxious. Why do you think? Why do you think AI feels emotionally more secure for somebody to reach out rather than talk to a human?
Well, I think there's a couple reasons for that. And I think first is ease. And we have been conditioned as a human population now to look for ease. We don't have to think about anything like, oh, what's the name of that movie? I can't think. Let me ask Alexa, right? Or let me ask my phone. So we like the ease of it. And I also think that to be truly connected to another the way we're meant to be as humans, it takes a lot of vulnerability, and that's hard work. So it can be easier to strike up a quote unquote conversation with a bot or, someone that's available 24/7. So, why not? But it's never going to replace human connection. And that's what scares me as
Hmm.
as a social scientist, right? I am a doctor of psychology. I don't draw blood. I can't give you metrics. I am social in that my way of diagnosing and understanding is through verbal and nonverbal communication and assessment. And I just feel like the more we rely on technology, the less we're going to be equipped to interact on a human level.
Okay. So let's look at a couple of things. What what can AI do well under the umbrella for mental health? Sometimes they help you track your mood and all kinds of crazy.
Mhm.
So what can just being fair as a journalist, looking at both sides, what can it do well? And then we're gonna what can it do well and what it should never replace. So this is a two-pronged question, the good and the
Okay.
bad. That was a
So
movie, The Good, the Bad, and the Ugly.
I think AI is great. And I tell people on a regular basis because I'm constantly in a space, Calvin, where AI is front and center, whether it's for electronic health record technology, business solutions. And my tagline is always that I'm fascinated and I'm frightened simultaneously, right? I'm wowed and fascinated by everything it can do, but I'm also frightened because of all of the things it's replacing. So I think from a mental health perspective, AI is good for that first contact, like asking questions. I'm feeling this, this, and this. Do you think I could be depressed? And if it says yes, well, then the next question would be, what should I do now? And that's where AI is helpful in referring you
Or,
to the appropriate care. I think what's dangerous and what it can't replicate is the actual connection, assessment, diagnosis, and treatment of a mental health disorder. Because no two people are alike, Calvin. I can have 50 people in a room with the same diagnosis and they all present in 50 different ways. And that's why I say it's, a social science or a soft science, because it's not like I take your blood and I say, oh, you have high cholesterol. It doesn't look like that. We don't work that way. And yes, we have pen and paper assessment tools, but a lot of the magic that happens in behavioral health care is just that keen experience of working with people and observing and knowing what things look like or the different ways certain mental health disorders can present itself. So I think AI is great. I use it daily. I tease my husband. I say, I think, ChatGPT is me now. It knows me better than I know me. Like we were talking before we were filming about how, it can create a bio about you that's better than you could have said yourself. So it's remarkable. It's a unbelievable resource that we have at our fingertips, but we have to be really careful to know that it's a tool and it's not a replacement for healthcare.
okay. Which is a good segue to my next question. Loneliness is at record levels, especially among young adults. We hear that, 10 times a day. Can I think I know the answer. I think, can AI ever meaningfully substitute for the human connection?
So I love that you're asking this while simultaneously wearing your Rutgers cap, because Rutgers has done a lot of research on loneliness and how it can actually be an illness, a disorder, and not just a symptom. That it's loneliness can cause us grave detriment to our physical and emotional well-being. And it's one of the biggest criteria when we're diagnosing depression. Are you isolating? Because it's not part of the human condition. We are social animals. We are meant to be connected. We're tribal. So when you're being reclusive or you were once social and you no longer are, that's cause for concern. So I think AI does fill a void to a point. And it's funny that we're talking about this because just yesterday I was having a conversation with colleagues about an article that I read in a journal it's a lifestyle magazine, not a peer-reviewed scholastic periodical, but it was about a very high-powered attorney a female, who went through a very traumatic divorce and was really struggling. And she essentially hired a boyfriend online, a chat bot, an AI bot, to text her every morning, "Good
Hmm.
morning, beautiful. You're amazing. You're going to crush it today
Wow.
at work," and would text her throughout the day. And at night, "Sweet dreams, gorgeous. You
I,
did an amazing job today." All while knowing there was no one really on the other end, but it helped her get over the hump of this black hole of despair post-divorce.
wow.
So this was, an anecdotal example of how AI helped a very educated, very accomplished woman get through a very dark time in her life.
Wow.
I have no issue with that, Calvin.
I,
If that is going to get you through the dark days of grief and mourning after losing your marriage and your life as you knew it, more power to you. But again, you still have to have a life outside of that. Are you connecting with friends? Are you sharing meals with people? Do you have activities and hobbies where you are still massaging that part of your life and not letting that social part of your being atrophy and die? So again, it's about that balance. Like, sure, use it, but it's a tool. It's not a replacement for human connection.
okay. Um, when a person shares, all this stuff, it's funny. I got divorced a ton of years ago, and it didn't do my head very well. I actually wrote about that experience in my book, The Tortoise. Uh, um, but I would have loved some kind of instant help, and there really wasn't much around
Mhm.
back in those days. This is the 70s, and there was really nothing around except, you all, which was kind of removed from my daily life. But anyway, uh, so when a person shares all this stuff, like you just described, all this stuff with AI, and it always responds, it never gets tired of listening. Uh, um, uh, um, is this dependence, and it is a dependence on this, is it real, and is it something that we have to worry about?
I think so, because there's so much data available to us already, Calvin, that proves that the human brain is changing. It's not the same. So if you take images of a human brain now compared to 10 years ago, there's a difference there. And that is what concerns me. We don't have a crystal ball. We're already living in a time where things we saw in the movies decades ago are coming to fruition, things that we never ever thought were possible. So I am concerned because I know for a fact that we're changing. We are, more and more birthing generations that are not naive to technology. I see it all the time, and it crushes my soul, to be honest. I'm not judging parents, but when I am out in public and I see an infant or toddler holding a phone and, watching it, or an iPad propped up in a restaurant, I I am scared because these are kids that are not making eye contact. They're not recognizing facial expression. They're not learning the beautiful art of conversation, which you and I have mastered, right? We could talk to anybody.
Yeah, correct.
It's a dying art, and I'm seeing it more and more in the workforce. They're weirded out by picking up a telephone. They don't know how to cold call. There's so much that's changing in our society, and it does scare me because it will impact how capable we are to be emotional and to meet needs and also have our needs met. So it does scare me. It really does.
Okay. Scares me too. Um, I have befriended a wonderful, amazing. We met because we were both pharmacists. He was a pharmacist in Egypt, and I was
Mm.
a pharmacist in Monmouth County. And he went on. His name is Mustafa Amar, and it's just a wonderful friendship. He went on. Watch where I go with this. So he went on to be a pharmacist, then became an Egyptian diplomatic ambassador in Beijing. Taught
Wow.
himself Chinese, stayed there a few years, then left that. He got tired and moved on, and he became an investment banker, raised $1 billion for Middle East, billions for Middle Eastern agriculture, and then got tired of that. And then he's writing books to help people change careers. And his latest thing is, I'm actually going to meet him in real life at Rutgers on Thursday. It's great.
Oh, nice.
So, bottom line, and I'm almost done leading up to this. Uh, um, Bottom line, his feeling is people coming into the world now, leaving college, they're going to need 4 careers because of AI. You got to do a little of this, and you got to do a little of that, and a little of this, and a little of that. So, and I've been reading and listening to him, and I realize he's really right. And so I wanted to write an essay. And the essay is to all the people who are on TikTok. I'm recreating a scene from the movie Moonstruck when Cher slaps Nicolas Cage in the face and tells him to snap out of it. So to all you people on TikTok are watching somebody dance for 15 or 20 seconds and you're spending your days doing that, you're getting slapped. You better start looking for 4 things to do in this world, or the world is going to pass you by. So,
Mm.
some people are self-diagnosing. This is how I set this up. Some people are self-diagnosing with TikTok and web forums and now AI. What are the real dangers in that?
So again, I couldn't be happier that you brought this up. And before I answer, I'm just going to vent that one of my pet peeves is having a client sit down in front of me and say, so I was looking on TikTok and I think I have ADHD, or, TikTok says, so I am hearing this all the time. And for all of you providers out there, whether it's mental health or any kind of healthcare, I'm sure you're all experiencing the same thing. And I will tell you that 99% of the time that clients come to me with this, they are incorrect. They are wrong. And, public service announcement, please don't take your advice from TikTok.
Hmm.
Unless it's someone who is credible and credentialed and they're well within their rights to share information. But we can't diagnose anything by watching a video on social media, and it is a danger. But I will say this, Calvin, because not everything is all bad. Sometimes when someone watches a video like that, it sets off a bell, an alarm, and they're like, "Oh my gosh, I think I may have." And it's what gives them awareness. But again, you need to take it to the appropriate source, right? Not
Mhm.
self-diagnose, not take matters into your own hands. Just like when WebMD first launched, it's probably decades now. Everyone was on there, checking out symptoms and, thinking they have cancer. And I mean, for the rare occasion where you found something obscure that you wouldn't have otherwise known, great, but more often than not, lay people are incorrect when they are diagnosing. So I would just say proceed with caution. TikTok to me, I have an account, so it's not like I'm a hypocrite. It's entertainment. I feel like it's not the go-to for self-diagnostics.
Okay. People who I think who are on TikTok should be paying a little bit more attention to podcasts of interest and
Yes.
learning real stuff like this. And that is, a pet peeve for me. And that's why I'm not going to write the essay, but I'd like to, and I'd like to slap, collectively a couple 100 million people's faces because I care and it's your world. You're inheriting the wind.
Yes, I am.
You're inheriting the wind. It's your world. And you got some amazing people out there who are saying you better get 3 or 4 different things you can do, and you'll be in a wonderful position. So do it. So if somebody's in crisis and they talk to AI instead of reaching out to a therapist or a hotline, or getting in touch with preferred behavioral health, et cetera, et cetera. How do we how do we kind of convince them that you really have to talk to a live person for your overall welfare? How do we go about that?
I would use this example because I think we've all been there, where we've dealt with a product, not even healthcare, let's say a product or a service, when all you want to do is speak to a human being, but you have a chat bot or you can't even get a phone number, but if you do, it's very difficult, right, to navigate through that tree to get to a live person. So mental health is no different. You will be able to acquire a solution and get the meaningful help that you need much better and faster than if you're trying to do it with a bot that is limited. Because at the end of the day, I know AI is very sophisticated. I demo it on a very regular basis for uses in my own world.
Well,
It's incredible how realistic the AI bots sound and how responsive they are and how smart they get by interacting. But there comes a point where there is a limit, just like in therapy, and I train therapists how to be therapists. I'm an educator. I always impress upon them that there's no hard and fast plan. For instance, if your client says this, then you say this. We're humans, we're unpredictable. There's always going to be something comes up that you just have to rely on your experience and your skills to navigate through that dialogue. And I don't know that an AI bot can ever do that. I think it's more concrete and we are complex emotional beings, and that's the one piece that AI cannot replicate, and that is human emotion, empathy, compassion, that deep sense of understanding. That's something that technology can't do.
now I'm digesting the
Mhm.
things you're saying. I'm scribbling some notes from here and there. I'm probably one of the few interviewers. I know Johnny Carson never took notes because I watched him carefully, but
Mhm.
I take notes and stuff. So, um, as we wind down this session anyway, as a CEO of a major mental health organization, do you see AI having a place in supporting the clinicians, like at preferred behavioral health, et cetera?
I do, very much so. We actually are very close to implementing AI technology in sessions where you can, like you said, you're taking notes, where you can be in session and be present, and there'll be a little device listening in, HIPAA compliant, of course, that is generating a note and a treatment plan based on the dialogue that's happening. So when your client walks out, you already have a note generated. You just review it for accuracy, tweak it, submit it. So it's going to really reduce the burden of documentation for our providers and also help as a clinical supervision tool because if your sessions are just, shooting the wind and talking casual and there's nothing clinical in the substance of the session, that's also a tool to help our clinicians be better at what they do. So that's definitely a piece of it. We've also piloted software that's very popular in the UK, where we have a heavy, heavy call volume, Calvin, and it's very difficult to not miss calls because of how heavy the volume is. So we've looked at AI technology where it can basically triage a phone call and guide you where you need to be,
Wow,
send you to the right department,
wow.
start like a pre-intake of sorts where it can start taking information from you. So, like I said, AI is a resource and a tool. I think that it should provide ease. It should, at least in my world, provide the opportunity where we can really focus on the work and focus on the humans that need the work versus the paperwork. So if it can alleviate that burden and make our processes more efficient, so we have more time to do what we're here to do, and that's to fill a very, severe gap in our society of where people need resources that they don't have, then that's wonderful. But we are not looking to use AI to replace human beings, to replace services. That is not where we're headed, nor do I think any other provider is. I know that there's a lot of venture capitalists out there and investors that are investing into technologies and things that can essentially replace therapists, especially because our workforce is always small and not sufficient enough to meet the demand. But I I shudder to think of what that would look like.
Oof. Yeah, scary. Some of that
Yeah.
stuff is really really scary, and it's funny. 15 years ago, 15 years ago, I was a big fan when I started my journalism of Ray Kurzweil, and a lot of people don't know who he is. He invented the synthesizer and the music and the keyboard. He's got it like 160 PhDs. He's off the charts, brilliant.
Wow.
And he started a think tank, and he branched it out and it became a university called Singularity. And Singularity actually made the cover of Time magazine a few years ago. And it's the point in our near future when man and machine become one.
Mm.
That's singularity, and all the repercussions and all the things, the ethics and everything involved. And I was always fascinated by that. And then it was a scientist there from Russia, and they had
Mm.
30 speakers, including Ken Jennings, the guy who won all that money on Jeopardy.
Yes, yes.
And he actually competed against IBM's Watson.
Wow.
Brilliant guy. And, Ken Jennings was there. I asked him a question, and he was roaming around. I talked to Ray Kurzweil. I've been practicing longevity. So does he. He takes 160 supplements a day. I only take 60. So,
And I thought I took a lot, but I don't take that many.
no, and I'm, so far it's working. Whatever. But, it's what you said. It is scary, and it was scary there. And then they had some Russian scientists who was trying to figure out a way like you use a USB thing to take everything up here, to take everything, my essence up here, and with a USB, plug it in and transfer everything to a cyborg, like the Terminator,
Yep.
and therefore giving me, because this is my essence, not my feet or my knees or my shoulder, but this, and transferring it and into a cyborg, giving me, immortality. And these are the kind of crazy things that people think about. Anyway, last two couple of things to kind of wrap things up in a positive note. What gives you hope right now, Dr. Tara, about people, resilience, and in our capacity to do good things and care for each other?
Well, I have to tell you, Calvin, that, and I say this frequently, that to be the CEO of a nonprofit organization like Preferred is one of, if not the biggest privilege of my life. And to lead a team of people that wake up every morning with fire in their bellies, passions in their hearts, and they give so much of themselves is inspirational, but I am blessed because at least once a day, I hear a story or some anecdote about a client, a person that works at Preferred, some story that manages to put a tear in my eye and fill my heart and make my faith in humanity restored. So, That's the first thing that comes to mind because I see it every day. And I just said to someone yesterday, because you and I talk to a lot of people, but I had a conversation yesterday and I said, I don't think accountants are having this kind of experience, and nothing against accountants. I need them. I love them. My son's in finance, but what I get to witness every day is such a source of joy and inspiration and feeds my hope. Um, and makes me remember how important human connection is and what it looks like when you've had so much trauma and so much hardship, and then one person touches your life and helps you and sees you in a way that no one else has. And the magic that happens in that moment and what the possibilities and potential are for you afterwards, it's just undescribable and it's not possible with AI.
Perfect. And you know what? That's just a perfect way to do a wrap for this. Um, I can't thank you enough. I always thank you enough for sharing. And I marvel at you and how you put things together. And I also marvel, at running you're the CEO of an amazing organization uh, that's doing so much good and so needed. And you've been around for a long time. So thanks for giving me the time and so we can share this. It's good stuff. And hey, come back and and it's endless the things that we can talk about. And again, people need to hear these things again and again and again and again till it finally sinks in and becomes part of their grasp and their understanding. So really, thank you so much, Dr. Tara.
My
Truly.
pleasure. Thank you, Calvin, my friend. I'll be
Thank
back,
you.
I promise.
Great. That's what Arnold Schwartz said in the
Oh,
Terminator.
that's right. What a way to end it.
That's the perfect way. I'll be back. We
I'll
will be
be
back.
back.
Thank you. Don't leave. I'm just going to stop recording and we'll do a 30-second wrap.